The second class on leukemia shall be AML, acute myeloid leukemia. Oh my God, exam. It can be an essay, a short note, viva, chart, whatsoever. And this is something I would like you people to follow this diagram. In any of these pictures, you will have to describe the RBCs, which are usually normocytic, normochromic. And there will be a mild anemia, which can become severe, 8 to 3 grams. WBCs are increased in number, starts with less than 50,000, but can go to more than 2 lakhs. There is a condition called a subleukemic leukemia, where the count is very low, for which we will be using a Buffy code, MCQ. Morphologically, the leukemic cells are blast cells. I shall be describing them. There is a maturation arrest. Remember, A for arrest. In 20% in the peripheral blood and 30% in the bone marrow. I shall describe the cell. There can be inclusions called as R.A.T.S. In myelomonocytic, both myeloid and monocytic lineages can be seen. Please by heart this entire. Cytological and cytochemical classifications are required. So in this one, AML classification. AML with recurrent genetic abnormalities with myelodysplasia, therapy-related AML not otherwise specified, myeloid sarcoma, that is scleroma, myeloid proliferations in Down syndrome, and blastic plasmacytoid dendritic cell neoplasm. That is a WHO classification. Kindly write this also and you score additional marks. And courtesy hematology outlines, this is how you people should describe a blast cell. It is a large cell and it has got abundant cytoplasm, but the problem is the nucleus is also very large. It can be 3 to 4 out of 5 in ratio. The nucleus is large. There can be, look at this pale area, they are the nucleoli. Prominent nucleoli 2 to 5 in number. And there can be rod-like inclusions from the primary granules called the hour rods. Sometimes they can be multiple. High NC ratio. So look at this picture. Again, you will be describing. Always RBCs will be normal, normocytic, normochromic. WBC, you can compare the size. They are large cells. The nucleus is convoluted. Look at this particular nucleus. It has got any number of bends that we can see. And it can be having prominent nucleolus. R.A.T.S are seen here, the black arrow. So you will have to mention the cell size, nucleus, inclusion. Your diagnosis will have to be an acute leukemia. This particular picture, I do not want you to move without describing. So in this, I am seeing increased number of large cells. How do I say increased? You count them. See the percentage. Large convoluted nucleus. So it is bent as though you have folded a wet cloth. That is the typical description I give. And there is an increased NC ratio, nuclear cytoplasmic. All these pale areas are nucleoli, abundant cytoplasm. All rods are the inclusions. Look at this arrow that is showing. Some of the cells are having bleps and vacuoles. That is because of a monocytic lineage. But you will write a common description for AML. And in the bone marrow, always a bone marrow has got a pattern for description. Cellularity, erythropoiesis, leukopoiesis, megakaryopoiesis, lymphocytes, plasma cells, mitosis, and others. Please by heart this for any answer. Now what you will be seeing is cellularity is increased because of leukemia. Erythropoiesis suppressed. Leukopoiesis will be showing a leukemia with immature cells or blasts. Megakaryopoiesis suppressed. Lymphocytes, plasma cells may be unremarkable or relatively suppressed. Mitosis can be increased because of the stem cells. Others, you find no parasites, etc. Scleroma is an extramedullary tumor that occurs in a case of AML. This is one particular diagram or table which I want you people to definitely by heart. What are the differences between lymphoblast and myeloblast? If you are a clever student, you can use this chart for ALL or AML or the morphology of a blast whatsoever. So these are the differences. The sizes are given, shape, cytoplasm. The exact thing I would like you to buy heart. For example, this is more round, this is more convoluted. Here I see hardly about 1 to 2 nucleoli. Here it will be multiple, 2 to 5. And then there is a more pale cytoplasm. Here it has got a bluish tinge. And when you do a cytochemistry, PAS will be showing block positivity, whereas it will be positive only in a case of erythroleukemia. Please by heart this entire table. The second class is complete.